Pulsation and breathing pattern assessment can be done during vital signs taking. In these two, it is important to note the following parameters: character, amplitude, rate, and rhythm. Here are some breathing patterns that can commonly be heard in patients. Okay, so we are now going to assess our heart sounds. So in assessing our heart sounds, we need to palpate or auscultate four locations. So we are going to locate the aortic, pulmonic, tricuspid, and mitral valve. And this is their location in the patient's body. So to start our assessment, we need a stethoscope and we have to have our patient take off their shirt. So, sir, can you please take off your shirt? Oh. For the first part, we're going to auscultate the aortic valve. So, we're going to palpate the clavicle. So, it's around this area. And then after the clavicle, there will be a hollow space. So, in that space, that's the first intercostal space. And then you go down a little and you're gonna palpate the rib. And then after the rib, you're gonna palpate a little bit lower again, and that's the second intercostal space. In that area, that's where you will hear the aortic valve. So from what we palpated earlier, which is the aortic valve, you just go to the left side, and that is where the pulmonic valve will be. So the next valve to palpate is the tricuspid valve, which is located at the fourth intercostal space on the left side. So it is usually found on the nipple line. So you just go straight from the nipple line and then. So okay, from the tricuspid valve, which is on the fourth intercostal space, we go to the mitral valve. The mitral valve is located on the fifth intercostal space and can be auscultated under the nipple.
So aside from the auscultation of the heart sounds, it's also important to auscultate for the breath sounds. Now we have three lobes, which is the upper, middle, and the lower lobe. So now each will be discussed and will be palpated into its proper location. So let's start with the upper lobe. So for the apical segment or the superior segment of the right and left upper lobe, so it is palpate for the clavicle, so it's immediately above and below the clavicle. So it's also important that when you auscultate, you position your hand you hold the stethoscope in this way. So this is the clavicle. So immediately above and below the clavicle would be your apical segment of the upper lobe. So right and left. Next would be the anterior segment of the upper lobe. So it is between the clavicle and the nipple. So it's somewhere here. For the middle lobe, we have two segments, which is the middle segment and the lingular segment. So the right lung would possess the middle segment and the left lung would possess the lingular segment. So for the middle segment, it is medial and lateral to the nipple. And for the lingular segment, it will be superior and inferior to the nipple. For the lower lobe, so we have the anterior segment of the lower lobe, right and left. So it is lateral and below your nipple, so it's somewhere here for the right and somewhere here for the left. So for the lateral segment of the lower lobe, it is important that you palpate for the inferior angle of the scapula. In doing so, you can ask the patient to internally rotate the arm by doing this position. So you will be able to palpate for the inferior angle of the scapula. And then in mid-axillary line, just below the scapula, this will be your auscultation site for your lateral segment of the right and the left lower lobe. For the apical segment, it's important to ask the patient to bend the head and palpate for C7. So upon palpation for C7, immediately lateral and below C7 would be your apical segment of the right and the left upper lobe. And then palpate for your acromion process, and then palpate further until the root of the spine, and that will be your posterior segment of your right upper lobe. So it's only for the right it's only for the right lung. For the lower lobe, for the superior segment of the lower lobe, so it's medial to the scapula. So it's in between the root of the spine of the scapula and the inferior angle of the scapula. So it's somewhere here for the left and for the right. And then for the posterior segment of the lower lobe, so it is in medial and inferior to the inferior angle of the scapula. So it's important to palpate the inferior angle of the scapula. And medial and lower to that will be your location for the posterior segment of the right and left lower lobe. So it's somewhere here. And then you can also palpate for the lateral segment of the lower lobe, which is mid-axillary line and just below the scapula. So it's somewhere here. So now, since we already know the location of auscultation for the breath sound, it's important to know the proper sequence for both the anterior and posterior auscultation of the breath sounds. But it's also important that we stay at the side of the patient so that whenever the patient feels like coughing or sneezing, we won't be in the way. And then we also need to remember that the proper holding of our stent would be in this way so that our hands are away from the patient's body. And then it's also important to tell the patient that upon auscultation, it's supposed to be your normal breathing. So relax normal breathing. So now we will be following the proper steps of auscultation for the anterior portion. For the posterior portion of auscultation of breath sounds, this is the proper sequence. Following the same procedure as done with the breath sounds, you can also check and assess for the voice sounds. So, in contrast to the breath sounds, which is normal breathing for the patient, it's important to instruct the patient for the voice sounds that they have to inhale and exhale, inhale through the nose and exhale through the mouth, and then make them say 99 EE 99. 99, EE, and 99 to assess for the proper voice sounds.
So now we're going to do the palpation part for our pulmonary assessment. So first, I'm going to assess the vocal and the tactile femmitus. The vocal or the tactile femmitus is the vibration produced by the voice and is transmitted to the chest wall. When doing this assessment, the therapist must use the ulnar side of the hand and will palpate in 3 places. So we're going to be palpating in 3 locations. In this area for the upper lobe, this area for the middle lobe, and in this area for the lower lobe. While palpating, ask the patient to say some words such as, "Sir, can you please say 99?"
99.
So while palpating, ask the patient to repeat the words.
99.
Okay?
99. 99.
Okay. For the posterior part of the assessment of vocal and tactile femmitus, you can palpate for the same areas. Here, here, and here. And then ask the patient to say the word. So, sir, please say 99.
99. 99. 99.
Go. So next, we're going to assess the mediastinal shift. In this, we're just locating the position of the mediastinum, and to do this, you have to palpate for the jugular notch. So when palpating, check for any deviations from its usual midline position.
Okay, so what we'll be doing is chest symmetry and mobility. So this is for the for us to assess if the expansion of the chest is expansion of the chest is normal, and if it is symmetrical during breathing. So for the upper lobe, we have to palpate for the sternum, and then we place our thumbs here and ask the patient to inhale. So inhale, sir. So as we can see, that the separation is symmetrical, so which means this is normal. So and then exhale again. So an example of a asymmetrical is whenever a patient inhales again, there is one that does not move as much as the other. So this means that the left side is hypomobile. Okay. So
Go.
for the next assessment, we will be doing the middle lobe. So here, the landmark is the xiphoid process. So you have to palpate for the xiphoid process. And then just as before, we ask the patient to inhale. And then check if the expansion or if it expands symmetrically. Okay? Okay, good. So next we will be doing percussion assessment. This is just to suggest the changes in lung density. So there are 3 types, which is resonant, hyperresonant, and hyporesonant. So in percussion, we will be performing percussion on the intercostal spaces. So you will start with the first intercostal space, which is located right below the clavicle. So we palpate for the clavicle and is located here. So we will only be tapping it once with our index finger, and we will be tapping it right on top of the other index finger placed on the intercostal space. So we only gently tap it once, and once you hear it, and if you do not hear it, you can only repeat it, pero you cannot do it multiple times. So we will do this for each intercostal space to know the different lung densities.
So now we are going to do the cough assessment for our patient. For the cough assessment, we are going to use this table for our result. Now, for our functional result, the patient can cough and can expel the sputum. For weak functional, the patient can cough and has difficulty in expelling sputum, or the patient has difficulty in coughing and can expel the sputum. For the non-functional, the patient has difficulty in coughing and expelling sputum. For 0, the patient cannot cough or expel sputum. So you would instruct your patient to cough normally, and then if he has a sputum, he can spit it in this kidney basin. So now, sir, can you please cough normally? So there. That's how you assess for the cough of the patient. Also important to take note of the color, odor, amount, and texture of the sputum. For the odor, it is important to let the patient smell the odor of the sputum because we might catch their disease. For the amount, it should be 100 ml or 2 tablespoons for the normal amounts.
So lastly, what we're going to assess is for the chest expansion of the patient. This is the table we are going to use when assessing it. So we have to indicate the maximum inspiration and maximum expiration of the patient and their difference. The normal difference is 2 to 3 inches, but what we're going to use is centimeters. So we still have to convert it to inches to know if it's normal or not. So the landmarks that we should palpate is the axillary, the xiphoid, which is at the T6, and the subcostal margin, which is palpated under the last rib. So that's what we're going to measure. So sir, what I want you to do is maximally inhale and hold your breath, and then after is maximally exhale. Can you do it? 1, 2, 3, go. Okay, and then exhale. Exhale. Maximally inhale. And then exhale.